Hello and welcome to Well with Del. Today in the program we're going to be talking about elbow problems, specifically tennis elbow and golfer's elbow. Now some of you may have experienced this problem in the past and may not have been a tennis player or a golfer. But what happens with tennis elbow and golfer's elbow can really be limiting in your daily activities. Now the big difference between golfer's elbow and tennis elbow is what part of the elbow is actually inflamed. Golfer's elbow is also known as medial epicondylitis, and that's going to be found on the inner side of the elbow. And tennis elbow is going to be on the outer side of the elbow, which we call lateral epicondylitis. When the tendon connects into the elbow, the bones of the elbow, where that inflammation occurs is what causes us to have a lot of pain in and around the elbow and limiting us with our grip strength or even working on a mouse or lifting our hand upwards. So today we're going to talk about what types of treatments we have for this condition and how we can get you feeling better as fast as possible. Now, as we talked about earlier, there's two different types of tendonitis that we're covering today: lateral epicondylitis and medial epicondylitis. And when the patient is standing in a neutral position, this is considered lateral, and this is our medial side. Medial is always easy to remember because it's closer to me, right, to the patient. So when we palpate through here on tennis elbow, which is the lateral part, when we contact right on that bone right there, that's where a lot of people have a lot of pain. Now, I'll remind you right from the start, we don't want to push right on that area except for one thing. And what that is for is a lot of times a chiropractor will make an adjustment on the elbow to move that bone and make sure the joint is functioning much better. Also, on the medial side, if you're feeling pain in there, you'll feel it on that big bone right there. And this is where the flexor muscles connect into the elbow. These muscles, if it's golfer's elbow, when you squeeze your hand or when you make a fist like that, if you feel pain on the inside, that's going to be the golfer's elbow. So on the tennis elbow, you're going to find more of when you extend the wrist up. So if Max here tries to lift his hand up and I push down, you can see the muscles in his arm start to work. These are our extensor muscles of our wrist and of our fingers. When that happens, that's where we're going to get some pain in that area. Remember, tendonitis is where the muscle connects into the bone. So we don't want to push too much on that attachment site or else we're going to aggravate it more. One of the most important things that we need to do is, as I said earlier, was to get ice on this as soon as possible. Now, as a chiropractor, I want to get this joint moving as best as I can. So what I will feel for, I'll feel for what we call fixation or poor motion in the elbow area, and also we'll even check the wrist out. And sometimes this can actually be coming from the shoulder or even a neck injury as well. So with Max here, as I palpate through here, these muscles on Max are extremely, extremely tight. Max has been experiencing some of the tennis elbow symptoms. So we've made the adjustment to his elbow, but our next step is going to be to try to reduce the stress on that tendon. And once again, that's where the muscle is connecting into the bone. Our next step that we want to do is we're going to use a ionophoresis. And what we do with that is it's an ultrasound where we mix in a good inflammatory agent like a CBD, a product with some menthol, as well as the ultrasound gel. So we show you what that looks like, and then we'll move on to a different procedure after that. Okay, so what we're doing right now on Max is called ultrasound. And what that is, we're going to put sound waves into the area of concern, and that will really help with removing the inflammation. And so what we did is a combination of the ultrasound gel, which is going to give us a good connection, but also we're going to use the sound waves to push our favorite product, the Lemgrove CBD oil, into the area of concern, which is primarily the muscles that go into the lateral part of the elbow. Now with this, we don't want to push too hard around the lateral epicondyle, which is the bony prominence, but we can lightly go around it and make sure that we cover the entire area, as well as the lower part of the elbow and the upper part of the forearm. So we want to make sure that we're working this area and reducing the inflammation. Now after this, we'll move on to our next step, which is going to be ice. So one of the most important treatments to get the elbow feeling better is the ice. And as you can see here, Max has an ice pack wrapped around the elbow. It can even tuck around, and we want to leave it right on that sore spot. This is good to not only on the elbow, but also into the forearm, or even slightly above the elbow is also helpful. As we talked about in an earlier show, we have to be careful with the ice. Remember, we're going to use the ice for 15 to 20 minutes, leave it off for an hour before we reapply the ice. Now, if you don't have a lot of time, you can take an ice cube, put it in a paper towel, and when you take that ice cube, you can put it in a paper towel so you can hold it, and you can run it right around that area for just 1 minute. You can do it 1 minute, but you can do it multiple times throughout the day. You don't need your 15 to 20 minutes. But we don't want to go more than 1 minute on that area. It's a smaller area, so you can use your ice cube. So it might be a little bit more easier to find a ice cube throughout the day than it is to have an ice pack. So that's something we want to do as much as we can as well. The other thing that people find that works well is they can take a Dixie cup, fill it up with water, stick it in the freezer, and then they can hold it that way and peel apart around the Dixie cup, and that way they can apply to that area. Once again, keeping that to a minute, minute and a half as you get to a larger area. So you don't want to keep the direct ice on there too long, as you can create a frostbite or a burn. So we want to be very cautious of that as well. So the next thing we want to add at home is stretches. We want to make sure we're doing these stretches throughout the day. So we want to take the hand out like this, then take your other hand, and Max, you can show us, you're going to grab these fingers and pull them towards you. Relax, nice stretch, keeping the elbow straight. This is more for our golfer's elbow, where they're going to feel this more on the inside. Whereas when we go downward and he pulls the hand in, he's going to feel more of a stretch where he's having a problem at, and that's going to be more on the lateral side, more of the tennis elbow area. Now you also find if Max takes his finger and does one finger at a time, so take one finger and stretch it each at a time, pulling towards you. Now you'll find usually that one of these digits will cause a little bit more pain than the other ones. And that's because these muscles which come down here wound up being the tendons which go to our finger extensors. So when we work these muscles out, take the stress off these muscles so that we can ultimately take the stress off of the connection point of that tendon into the lateral epicondyle. We want to stretch these areas out, but we also want to stretch these finger muscles, flexors, as well as extensors. One of the other things that we know is beneficial for inflammation is an anti-inflammatory. But if you look back at some of our talks on inflammation, you'll realize you have to be very careful with that. You have to be very careful when you resort to the Motrins, the Advils, and so forth, because they can have a negative effect on our body elsewhere. So the Motrins, the ibuprofens, the Advils, they can help with this, but I recommend to my patients no more than 3 days of the maximum dosage if you're really in a tough time. But this is a problem that will last for can last for weeks upwards to a couple of months if untreated. So you don't want to rely on the anti-inflammatories. Another thing that has worked for a lot of people, and it usually works for a short period of time before it quits working, and that is a brace. So this is either what they call a tennis elbow brace or a golfer's elbow brace. And what it does is we put this on Max here. I'll put this through his, let's put this through here. And we're going to put this not up where it hurts. We're actually going to put this in the belly of the muscle in here before it gets up to that tendon area. So now it sort of tricks the brain into thinking that this is the bone, so that it's able to rest this part where the inflammation is. So these can work very well, especially if you have a job you have to use your wrists, or you just really can't rest it all that well, or you don't have that kind of occupation that you can step away from it for a while. So this works very, very well, but once again, it's a short-term fix. Most people get a couple of weeks relief with it, but at this point, you want to try all the different things that you can do to try to get you feeling better as fast as possible. These can be purchased anywhere. They range anywhere from $10 to $20. Don't go overboard with all the different gadgets. You just need something that's going to get in there and put the pressure on the muscle to take the stress off of the tendon. So remember, the first thing you need to do is change or alter the way you're doing the activity that is causing this. One of the things that we didn't talk about during the treatment session is if you find that you're waking up in the morning and the elbows are sore or the hands are numb, we do have a tendency to revert to that fetal position whenever we're sleeping at nighttime. So one of the things that you could do is put a brace on the wrist, something that's going to limit wrist flexion. It's going to be hard to limit your fingers from flexing, but sometimes my patients have found some improvements by just grabbing the bowling brace out of the bowling bag and putting that on their wrist and sleeping with that. Or you could pick up some inexpensive braces at the drugstore, Walmart, or one of the other places that carry them for probably $5 to $8 per brace. So that's something that you could try as well. But remember the tips that we showed you earlier, those should help significantly. And remember, you're going to talk about a 4 to 8 week recovery time with this, but that's only after you've stopped or changed the routine that's causing this. So we hope you learned something today. We hope you love our program Well with Del. Please subscribe, and we're looking forward to seeing you next time.